My name is Tiffini Scott Turner. I've been coming to OSC for a few years now. I started with back issues. I started doing CNA work when I was 16, so it just got to the point where my back was constantly in excruciating pain, and I was referred here from my primary care doctor. And I've been coming ever since. It's my lower back. Like I said, from seeing different doctors, nobody could ever really figure out what was what outside of the biggest thing I heard was I was overweight, which when I first started, I was almost 400 pounds. But since then, I'm now down to about 260. So it still didn't make a difference. So finally coming here, getting with Dr. McFarland, him actually saying, okay, we're going to figure this out. So he found out that I have, outside of having one leg a little bit longer than the other, I also have degenerative disc disease, and I have arthritis in my spine and my lower back. So we started with injections. I get the epidural injections, which do pretty good. I usually have to come back maybe every year and a half, 2 years to get another injection. And that helps. It doesn't completely take away the pain, but it's tolerable compared to where it was. From there, he started seeing me for my neck, for issues with my neck. I was losing feeling in my left arm, radiating pains from my neck down to my fingertips. The doctors I was seeing pretty much was just giving me pain, well, not pain pills, but here, try this, and nothing worked. So I just happened to generally ask a question to Dr. McFarland one day, like, hey, could my back be affecting my neck? And from that, just like before, it's like, okay, let's do these tests and figure out what's going on. And he found out that my C5 and C6 was compressed, and I had limited fluid running through my nerves. So, and I also had bone spurs forming around it. So I actually just had cervical fusion done on Valentine's Day of this year. So I pretty much had no strength, which is slowly coming back now in my left side. Constant pain running down my neck, down into my arms and my fingers. I had no feeling in 4 of my fingers. And pretty much in a nutshell, after MRIs and tests, it was one of those things where I could, knock on wood, I could have a stroke and not be able to tell the difference because of the symptoms I was already feeling. So after talking to Dr. McFarland, he told me what I could do. That we tried physical therapy. We also tried injections with him, and nothing helped. So it was like, okay, well, this is what we need to do. We need to go in and relieve those bone spurs and that compression off that nerve before you literally have pretty much no feeling at all. I don't think nobody's ever prepared per se for surgery, but I was not confident is the word I want to use, but reassuring. Dr. McFarland explained everything. He told me the pros and cons, pretty much of what I'm dealing with, that to relieve that pressure off of that nerve, this was the best option to do. And I felt confident, after talking to him, that for the sake of myself, especially with having small children, it was what I needed to do. It wasn't bad, but, to have to be in a neck brace for a couple of weeks, it was, I guess, uncomfortable. It's still a transition because I have a cadaver bone that's in place now. So that's fusing together. So there's still some pains, some tweaks and things like that. I've It's a difference to have to not be able to sleep in your bed and a recliner becomes your life for a while. So I'm just finally transitioning back to my bed, but even now I still have to sleep with like a neck pillow for comfortability. Like I said, I've been coming here for maybe 5-6 years, somewhere around that. I guess about 4 or 5 years, and in between 4 to 6 years. But I would definitely recommend coming here because, like I said, I went to other doctors before here, and they were just, let's try water therapy, let's try physical therapy, let's try gabapentin, let's try, but it was never, hey, let's run these tests and see what's actually going on, and then we try everything else. So that was actually done once I got here. It was like, let's find the cause of it, then we'll figure out a remedy. Find a doctor that's going to listen and fully take in your concerns about what you're dealing with. Like I said, with Dr. McFarland, he listens, he explains everything so that you have a full understanding. Even before surgery, he tells you exactly what he's going to do. He'll mark everything and where he's going to do it at. And he just wants to make you as comfortable per se as possible.